A very warm welcome to this webinar from our series, Let's Hear It From the Expert. I believe all of you are enjoying our different webinars also. And today's webinar is something very special for me too. Reason being an REBT practitioner and REBT trainer, I have a stalwart in the field, Dr. Matweychuk, who is on board for this webinar with us. So I'm going to quickly introduce to all of you, and then he's going to talk us all about the lifestyle change and adaptations pre, during, and post-pandemic, because I believe pre-pandemic, the way people live their life, and nobody is an exception to that, it's way too different than how post-pandemic the phase is going to look like with whatever happened during the pandemic or whatever is happening right now. So he's going to tell us some healthy ways to deal with it, the healthy mindset to adapt. Few questions that have come into me, I'm going to ask him, and he will be talking us all about the same. And what I'm going to do is at the end of the talk with Dr. Matweychuk, I'm going to open this entire platform for the audience. So we're going to have the Q&A session at the end. So if you have any kind of questions during the talk, please make sure you note them down in your diary. And later on, when I open the platform, you can ask them. Meanwhile, try to keep your microphone mute so that there is no disturbance and everyone will be able to hear him very clearly, right? So once again, warm welcome to EMOTICONS India's webinar on lifestyle changes and adaptation. EMOTICONS India is an organization which is a psychological counseling, testing, training, and a research center. And I am Nikunja Gujar, a founder and director of EMOTICONS, and I personally have been practicing REBT. So being an REBT practitioner and trainer, I not just admire, but have been very, very inspired with a lot of work that Dr. Matweychuk does. Dr. Matweychuk is a clinical psychologist. He is the professor in Pennsylvania University as well as New York University. And also, Dr. Matweychuk, you have written a book, you have authored a book on Newcomer's Guide to REBT, Rational Emotive Behavior Therapy, right? Yes, he's a REBT supervisor. He's closely worked with Dr. Ellis and Dr. Beck, who are the founders of cognitive behavior therapy. And he loves disseminating this entire REBT to not just the mental health experts, but also to people who are probably layman, right? As we were getting in a discussion before, how he tries to make it very simple and reaches out with this philosophy of REBT to everyone and anyone. So without much of ado, I would like to open the stage for Dr. Matweychuk. And to begin with, I have this entire idea to first address the question of how does this entire lifestyle change has impacted during this pandemic or with the pandemic on a person's psychological makeup, on person's personality. So would you share something to begin with on that line?
Well, I don't know if it's changed their personality, but it certainly has impacted their mood and their day-to-day functioning. My experience with my own patient load, and I see roughly 35 people a week, that people are experiencing a good deal of stress, anxiety, worry, depression, anger, and that's in response to a number of different adversities that are naturally occurring as a function of this pandemic. Some of which include uncertainty about how best to protect oneself, the deprivation that comes from being not with your friends physically. Virtual reality is a nice thing, but obviously we're social beings that enjoy touch, so that's out the window. And then, of course, a great deal of uncertainty around what the future will hold, economic problems and loss. My niece had her wedding canceled. My other niece is pregnant now, so I'm not sure if I'd be thrilled if my wife was pregnant during a pandemic, because there's so many unknowns. And And then, of course, I would have been in Positano, Italy, if it had not been for the pandemic now, approaching my 60th birthday celebration. So I missed out on Italy. So that's the least of it. I've only been inconvenienced by the pandemic, where other people have been greatly impacted. And it stands to reason they would then have all sorts of axis one-like reactions, adjustment disorders or acute stress disorders of anxiety, depression, anger, etc. So that's how it's impacted them. And then, of course, behaviorally, it has impacted them insofar as all the good and bad habits that people have for coping with their anxiety, anger, depression, and other dysfunctional emotions tend to be utilized more. So if you're prone to the consumption of alcohol, you may do more of that. If you are prone to more pernicious behaviors like cutting, in the case of borderline personality disorder or something like that, you may see more of that, arguing, etc. So there's just a whole host of behavioral problems that are also occurring. So, but I don't want to paint a grim picture here. All is not lost. One can, William Shakespeare, and As You Like It said, sweet are the uses of adversity.
Yes.
And I firmly believe, and then of course, the German philosopher, I think it was Nietzsche, said that which doesn't kill you makes you stronger. So where there's adversity, there's opportunity if one only knows how to leverage the opportunity. So let's not be too pessimistic, but we'll get the dark side, the grim side of it out of the way first, and then we'll go to the coping side.
Right, that's true. So I think perhaps it's really, really important to even understand, and maybe you would share with us something on that line, where now after this pandemic, people have to come out of this entire pandemic situation with a growth mindset. Yeah. Than the mindset which is unhealthy, perhaps what we call in REBT. So how can one adapt to positive habits or positive mindset, or to these changes for, let's say, lifestyle changes? So how can one adapt in a healthy manner?
Adopt, and adapt, right?
Right.
Adopt healthy lifestyle habits, and how do they adapt them? So in my view, they can do that by becoming familiar with the philosophy and attitudes of Rational Emotive Behavior Therapy, because it will facilitate the discipline one needs to adapt, to make the changes one had better make if they're going to have a good outcome. Now, they don't absolutely have to make these changes, but it would be better if they did. And so, for example, something as simple as wearing a mask, I hate my mask. I don't like it, but I wear it consistently because I say to myself, a rational attitude. I say, it's uncomfortable to wear a mask. It's not unbearable. I can bear the feeling, and it's worth doing because I want to stay healthy and I don't want to be a person who propagates the disease. So one way you can adapt a problem is for people to, can I ask somebody to mute their mic? I'm hearing a lot of
Yes.
distracting noise. Okay,
Right,
thank you.
Yes.
Yeah, so as I was saying, the way you adapt is by having a high discomfort tolerance.
Mm-hmm.
And you see that adaptation requires uncomfortable change, which you can either rebel against and say, I shouldn't have to make these changes, or you can accommodate with flexible and non-extreme attitudes. I wish I didn't have to make these changes, but it would be in my long-term best interest to do so, so I shall push myself. So adaptation revolves around adopting sensible attitudes that raise your discomfort tolerance for the behavioral changes you need to make. So for example, virtual dating is not ideal, but it sure beats not dating at all. And so I've
Right.
encouraged all my younger patients who live alone to learn how to talk to people before they start proceeding in the normal way that they would. And maybe there's a silver lining to virtual dating first, insofar as you get to know the person before you go to more intimate activities with them. And so what adaptation requires is a healthy attitude. Now you're calling it a growth mindset. You can call it a growth mindset. You can call it a rational attitude mindset.
Right.
You can call it a flexible mindset. Whatever
Absolutely.
you call it. But it has a great deal to do with one, commitment to doing what's required in the here and now, so that you have the best long-term outcome, all things considered.
Right.
So
I,
behaviorally, we're talking about things like wearing a mask. We're talking about things like working from home, and even there, if you're going to work from home, you can do it with a low standard, or you can do it with a real commitment to trying to give your employee a good effort. You don't have to goof off. It's easier to goof off when you're at home. And other adaptations would include learning to really exploit the leverage of the internet.
mm,
So I'm going to just stop there and allow you to respond, and then I could answer some
sure.
more. But high discomfort tolerance attitudes. You look, this pandemic causes inconvenience if you're lucky, and pain and sorrow and great loss if you're not lucky. Now, adaptation to inconvenience, as well as pain, loss, sorrow, and tremendous loss, like where a loved one dies,
Yeah.
revolves around acceptance and flexible attitudes and a high discomfort tolerance and life acceptance, accepting life as it is, not as it should be.
That's true.
And so a growth mindset is going to be a mindset of acceptance that things are as they are, whether we like them or not.
True. True. I agree. And I think you have very beautifully said that it's going to be an uncomfortable scenario, but there is a worthiness component which is attached to it. And that is why perhaps people would like to adapt to some flexible attitudes, because they are going to be worth adapting to, no matter they might temporarily also look uncomfortable to do so, because people are not used to thinking in that particular pattern. And another thing which you were talking about is this entire part being people facing the inconvenience, and also some of them going through an extra, or let's say more adversities or more inconvenience, right? But the lot of challenge that I'm sure people face here is actually intellectually understanding this and applying it in day-to-day life as well. So what could one do to really not remain this entire mindset just at the intellectual level, but also transfer it into their behavioral practice or their emotive practice?
Well, that's a great question. And first of all, what I would say is identify situations that will lend themselves to using this. So I always tell patients, if it's uncomfortable, it's likely to be therapeutic. So if you really want to adopt a rational attitude and take it from your head to your heart, you need to walk the talk. And one way of doing that is giving yourself homework assignments. And the best way to identify a homework assignment is to follow the discomfort, right? You know, when they try to uncover a scandal, they go follow the money trail. Well, you can follow the discomfort. So if it's uncomfortable for you, for example, to exercise, say for example, a person likes to do rigorous exercise in the gym, and now the gym is closed because of social distancing. Well, a homework assignment of adaptation would be going for a 30 or 40-minute walk, which won't be nearly as rigorous, but will produce some degree of health benefit, both for cardiovascularly and psychologically. And so do what's uncomfortable. That is the best way to develop. Now, of course, do what's uncomfortable if it's safe and therapeutic. So, for example, don't do something that's uncomfortable, that's crazy, such as jumping off a great height just to do something that's uncomfortable. No,
Right.
test yourself in sensible ways. But if you are, for example, rigid and you always exercise a certain way, and that way is no longer swimmers, people, pools. Some of my patients can't go swimming anymore. Well, if you can't go swimming, why don't you go walking?
Right.
Another way you can bring the ideas from the head to the heart, if you will, is through shame attack exercises. So, for example, and shame attacks are uncomfortable. So I'm more or less
Yes.
saying the same thing in a different sort of way.
Yes.
But if you are single and isolated, or even if you're not single and isolated, but getting involved in meetup groups, forcing yourself to ask a question. There's probably some people on this view today who are afraid to go out of their comfort zone and ask a stupid question. Well, I would suggest you ask the question that you're curious about, and if it's stupid, it's stupid. Who cares? It's not the end of the world. So it's very important to go out of your comfort zone. The second, and that's a behavioral way of getting these ideas into your head. If in another way you can get the ideas deeper from your head to your heart is by doing what's called rational emotive imagery. And Albert Ellis used to do rational emotive imagery with people as an alternative to just verbal disputing. And I used to think it was a silly exercise, but it turned out that I used it on a personal issue and it worked in a very wonderful way. And it's another way to get the rational water to seep into the sponge, so to speak. And so rational emotive imagery is where you imagine an adversity. So say, for example, you wake up in the mornings and you are socially isolated and you live alone and you're typically depressed. Well, you could, and the day before, in the afternoon, picture the next morning waking up and finding yourself depressed again because you know it's going to be more or less the same thing again and again. There's a certain routine to life, and the routine now is even more routinized because you can't have as much variety. You first make yourself depressed as you typically would be, and you close your eyes and make yourself depressed. And then, without changing the situation at point A, the adversity, you make yourself only feel displeased or annoyed or disappointed that it's another day of being alone. But you force yourself to transform your emotion from depression into disappointment or sadness or displeasure. And when you do this exercise every day, it only takes about 3 minutes. Very briefly, you do it. What you learn to do is essentially practice thinking rationally and transforming your unhealthy negative emotion into a healthy one. So I would say an emotive exercise is a good thing, aside from a behavioral exercise. I think another thing you can do is teach your friends rational thinking as a way of getting it into your deeper understanding. So, for example, in medicine, they say, watch one, do one, teach one, when they're talking about surgical procedures. So you could teach your friends to not upset themselves, not depress themselves, not anger themselves. So if me and you are talking on the screen and you're telling me how awful, terrible life is in the pandemic, and I sit here and saying, well, it's pretty bad, but it could be far worse, and it doesn't really help you to demand that life not be the way it is. You're only making yourself upset. Is that not the case? So you enter into a rational dialogue with your friends, and you really talk back to their irrational thinking. That's another way you could help get it into your bones. probably the best way also is to model it for your friends, because it's easy for me to tell you not to disturb yourself and not to anger yourself by saying things like the pandemic should not exist. But if I model it and you really see me implementing it, then I'm walking the talk.
Walking the talk, true.
And so the Stoic philosophers used to talk about how it was very popular in ancient Rome to attend a Stoic school and become a philosopher, but they would say, don't become a philosopher because it's sexy, become a philosopher because it's useful to you.
Absolutely.
So really try to walk the talk. Live in harmony with what REBT is encourage you to think about, which is flexible attitudes, non-extreme attitudes. This pandemic is bad, not awful. That is a non-extreme attitude. And so how would that translate into action? Well, you would get up, you would make the best of the day. It's bad. You don't have as many choices. You can't go out to the cinema or the movie theater. You can't go to the bowling alley. You can't go to the gym. What can you do? Well, you could sit out on your terrace. You could journal. You could contact your friends. So if you don't disturb yourself, you'll find you'll probably be a much better problem solver, a creative problem solver.
That's true. And that's so important because usually or most of the times people entire focus is on the problem than on solving the problem. And by solving the problem, which is perhaps about finding what is in my control possible that I can do, rather than trying to bring uncontrollable things under yourself. And many of them struggle just to make themselves understand that there are few things, unfortunately, sadly, and regretfully, that are not in my control. So that's a very important point, I believe. And in fact, what you told about completely that intellectual understanding, transferring it to the behavioral understanding and emotive understanding is so beautifully put, because we do practice this in our sessions with our clients. But this is something which, you do not necessarily have to go to a therapist to. You can practice it even every day. As you said, it just takes 3 to 4 minutes to do this entire practice. And
The
it's
rational emotive imagery, that's what you're talking about.
That's right.
That takes 3 or 4 minutes.
That's true. The shame attack one, I think, is going to come up towards the end of the chat, because now I think many of them might be motivated to just ask the questions and put themselves into this entire shame attack exercise. So yes, that's something which will definitely come in. What I was also thinking is all about training the mind, isn't it, Dr. Matweychuk? It's all about continuously day in and day out training your mind, because it's not going to be something which will transfer in one day or one night.
Yeah, I mean, I like to say disciplining the mind. Absolutely. Certainly, with physical fitness, right? We don't expect. I used to be a marathon runner, and I did the New York City Marathon for 13 consecutive years, and I survived all 13 of them before I became injured. And you don't prepare for a marathon in one week or 1 month. I would train for months and slowly build up. Right. And I think with rational thinking or flexible thinking, or however you want to think about it, however you want to label the type of thinking that we're talking about, humans have the capacity to think this way, but it doesn't come naturally. We're much more inclined to think in a rigid and dogmatic and extreme way. The pandemic should not exist. Life should be easy. You, Nikunja, should do things the way I want you to do them. You must do them the way I want you to do them. And dogma, even towards myself. I have to be perfect. I have to say things clearly. I must never err or use bad judgment. That type of thinking comes quite naturally. And the human condition is such that we are capable of cultivating flexible and non-extreme thinking that is consistent with the way reality really is. But it doesn't come naturally. It's analogous to physical fitness. If you're going to train a muscle, you're going to have to train it for many months. Same thing with the marathoning. I would train for months and build up. So if you're I've been at REBT now for 30 years. 30
Right.
years I've known about REBT, and I've known about cognitive behavior therapy for 35 years. So if you're going to commit yourself to getting more out of life and not disturbing yourself, you want to try to implement this every day, practice it every day, never discouraging yourself if you fail in a given day or a given opportunity, recognizing that there'll be future opportunities to practice. And so if you don't do this one so well, you'll have another one shortly to practice. And
Absolutely.
so you practice every day with realistic expectations that humans, I always say psychotherapy is a slow moving sport.
Okay.
It's not like surgery where you cut somebody open, excise the tumor, and sew them back up and send them on their merry way. Even if the surgery takes hours to do, it's still
Absolutely.
pretty quick.
That's the
Where
best analogy.
psychotherapy
Yeah.
is more like the tortoise rather than the hare, if you go back to the Aesop fable, where it's a slow-moving sport. However, little differences add up. And if you take one step after another every day, sooner or later, you will discipline your mind to adapt and be more flexible. I wish I could change quickly. I wish I could change easily, but I do not have to change easily. I do not have to change quickly. However, if I keep my wish and take one step after another towards change, I will find in time that the rate of change will increase. I think you can increase the rate of change as time goes on.
True.
And you will be amply rewarded for the consistent effort that you give at self-change.
That's right. And as you said, you have been practicing it for the last 30 years. So it's not a single day where you have not thought about it. You have been thinking about it and using it every day. That really speaks, because as a mental health professionals, it's so important that first you are convinced about the therapy that you're practicing. And the same goes here, that you have to be convinced yourself and try to practice what you earlier referred to, which is what you're talking, you're walking also. But you're
I always
preaching, you're
make a
practicing
joke to my
also.
patients. I always make a joke. I say to them, look, I practice this for 8 or 9 hours a day. Think
Okay.
about how crazy I would be if I didn't talk about this all day long. So I have an unfair advantage over you insofar as I'm thinking about these ideas all day long for 6 days a week.
That's right.
So you need to understand, you too are going to have to work at it. The other way, just to go back to one of your previous questions, you could get a voice recorder and say into the voice recorder with strong language some of the rational ideas that you're trying to internalize.
Wonderful.
Because that will help you internalize them. So you could say things like, I want to do perfectly well, but I never have to. You can put that into the tape recorder. You could say it 2 times, 3 times. I want to do perfectly well. Because remember, repetition is the mother of learning. Albert Ellis always said that, and it's an age-old idea. I'm sure he didn't invent that one. But repetition is the mother of learning. So I want to do well. I want to use good judgment, but I don't absolutely have to do so. I'll accept myself even when I do poorly, when I cop out. I'll just try to do better. And I won't use self-acceptance as a cop-out for not trying hard. There's a fine line between acknowledging you're fallible and using that idea against yourself to allow yourself to be not effortful and irresponsible, act irresponsibly. So you could take your rational ideas and read them into a tape recorder for 10 or 15 minutes a day, and then doing that, because by saying it, you're playing it through a different channel. If you read a book or you listen to one of my audio tapes on rebtdoctor.com, there are free audios that I have there and videos, that's coming in through your ears. But if you say it out through your mouth, it goes through a different circuitry, and now you're over-learning it, and that's how you deepen conviction. The other thing you could do is take an index card and write a rational idea on it and put it in different areas of your home so that you see the idea.
So you have the visual image.
So that's another way to help you internalize it. But I think that the saying it forcefully, you can't say it weakly. You really have to say, look, into the audio recorder. Look, I get it. Life doesn't have to be the way I want it to be. And Ninkunja, she too doesn't have to be the way I want her to be. No one has to do things my way, even if my way were the better way. So I better accept that. Now I can try to influence people to do things, but I'm going to start with the premise that I may fail, and that's not awful if I don't influence people and they don't do things my way. And I will accept that and not disturb myself. So by saying it forcefully into a recorder a couple times every day and doing that for 10 or 15 minutes, it's like doing push-ups where you're exercising the rational mindset for 10 or 15 minutes. You do that every day, and then something will happen. And then you'll respond differently automatically, and you'll go, oh no, look at that. I just did things differently than I normally would have.
Surprising your own self. Mm-hmm.
So you could surprise yourself if you stay with it. I always say to my patients, keep at it. Keep at it.
Right. That's right. That's a very precise difference between wanting to have something and must have something, which is the difference between the want and the must attitude. And I think the want attitude is what is going to take you a long way in a very healthier manner.
Yes, it's going to motivate you to get what Albert used to say all the time. Keep your wishes, keep your wants, but relinquish, give up your absolutistic must, have to, shoulds, needs. So if I have something I want, which is to teach people that REBT can help them. And so therefore I spend a lot of time doing it. But I don't say, well, you have to accept what I'm saying, or you have to work at it. But I do my bit and see how far it goes. After that, that's all you can do is do what you want and hope that the outcome goes your way. So keep your wishes, keep your wants, but don't cross that imaginary line into, and things have to be my way, because that's false.
Yes, right. Perfect. So that brings me to ask you another interesting question, which I personally also found interesting after reading a lot of work that you are doing, is about this entire idea of habits, right? Which you also referred initially to. So many of them during this entire pandemic time have developed certain habits, while some of them are healthy, but some of them are unhealthy too. And while one would like to continue maintaining those healthy habits, so what are those few things that people should be mindful or keep in their mind, even the post-pandemic phase, which will help them to be at the healthy mindset level? So that would include working on their thought process, as what we have been discussing so far. But there's a possibility that they may not get the immediate guaranteed reinforcement for their practice. So how would a person keep himself motivated even post-pandemic to keep those healthy habits alive?
Well, one thing I would say is that you want to keep good behavioral records, because when you keep a record, you tend to maintain momentum towards a target goal or target behavior. And so, for example, let's assume that during the pandemic, and for example, in the United States, there was talk that there might be some meat shortages, and you began to eat more vegetables, and you found that you lost some weight, and that was a good thing. Well, what you could do is every day on a calendar, first thing in the morning, weigh yourself, which is what I've done for years, because we know that people will gain weight over the course of their lifetime, but if they weigh themselves, they'll gain less weight over the course of their lifetime. So remember, it's REBT, the behavior therapy component, and in behavior therapy, you keep good records. So if you, for example, have gotten into the habit of going for a morning walk during the pandemic, well, you could write in your journal or in your calendar, I went for a walk 10 minutes today or 20 minutes, and every day that you go, you have it in your, so behavioral record keeping is one way. And in this, you can't see it, but every time, not only do I weigh myself every morning, but I have the days that I exercise. And if I do the bike or the rowing machine or lift weights, so you record. Good record keeping will help you maintain your habits. I think what you also want to do to maintain a habit is probably write down the goal. I mean, you know, when you identify something as a goal, there's a certain change that happens in your head. So I would say if you acquired some good habits, well, for example, washing your hands, you could say my goal for the duration of the pandemic is to consistently wear my mask, consistently wash my hands, and go for a daily walk first thing in the morning of 30 minutes. So there's your 3 goals.
Right.
And I would write them down on an index card. You could put them on your refrigerator so you see them, put a date next to it so you know when you made this commitment. I think it's good to commit to things. Another thing you could do to maintain momentum would be to tell a friend what your commitment is and have the friend check up on you, because there's something to be said for accountability to others. And so a lot of times psychotherapists play that role. People come in and tell you that they're sticking with their routine. The Stoics would argue that one way you can maintain your progress would be for reflection at the end of the day, seeing how well you practiced your goals, what you set out to do, where you went wrong, and reaffirm your commitment the next day. So that would help, would be to, at the end of the day, doing a review of how well you did at maintaining your target behaviors.
Yeah.
I think the other thing, which I just want to say again, is throughout the day, emotional disturbance will undermine momentum. So throughout the day, you want to keep in the ABC model of REBT in your mind. And as soon as you detect the slightest whiff of emotional disturbance, that you quickly zap it with a dispute, ABC analysis. Because if you get into a emotionally disturbed mood, you're less likely probably to do whatever it is that you want to do. You'll say, screw it, I'm not going to wash my hands every time I use the restroom, or wash my hands every time I come into the house and eat. Or I'm not going to every day I come in here, I take some alcohol things and wipe down the door handles, because every night a man comes in here and takes the trash out. So now I don't know if he's practicing good hygiene. So I have to, make sure that when I open the door, my hands are going to be relatively clean. So I've been maintaining good hand hygiene by having a healthy attitude, saying, look, it's a pain in the neck to do this, but it won't kill me. So you rehearse rational thinking, and then you dispute your irrational thinking as a way to maintain momentum. So there, just to review, you record your progress in doing things, you keep records, you journal how well you're doing, you keep reminders of discriminative stimuli that will signal that you have a goal in mind and that you want to stay with it. You reflect at the end of the day on how well you did. You could reinforce yourself too. You could say, for example, if I really stick to hand washing for 3 days or 4 days in a row, I'll give myself a small piece of chocolate. So a little reinforcement can go a long way. So reinforcement is a good thing to do. That's another thing. Or you could give yourself a special kind of coffee if you like coffee or something like that. So reinforcement, making reinforcement contingent on doing something in a given day or in a given series of days, that too can increase momentum. And it's always better to use reinforcements than punishments. I always say the carrot works better than the stick, but don't throw away the stick. You may need the stick too.
Right, that's right. And I think reinforcement also would encourage anyone's behavioral practice, and it won't just remain to the cognitive level or the intellectual understanding level.
Yes.
Okay.
Yeah, because the reinforcement is going to come from the behavioral execution. So
Right.
at the end of the day, if you want to adopt a rational attitude, force yourself to live in harmony with it. Do what's consistent with the attitude, and the attitude becomes yours in your head. This
Right.
behavior, it's like from the bottom up. The conviction comes from the bottom up,
That's
not
right.
top down.
That's right. Okay. So now while you're talking about this, the another thing that comes to my mind, which a lot of my clients also, we have a discussion on it, is about during this pandemic time, many of them have gotten into this entire understanding the goal or the purpose of life in itself. Many a time this question comes to me, which is, what's the entire meaning of life then? You know, so how would you like to share some of your thoughts or some kind of helpful strategies for people who are thinking in that line?
Well, that's a great question to ask. I'm, like I said, going to be 60 in a couple of days, and I certainly can see the end of the line. And so it's not so far away. I can spot it. And so I say to myself, look, you know, what do you want to do with the time that you have? Because the only thing that's certain is death. It's what's uncertain is the hour of death. So you better figure out, or at least experiment with, or give thought. So the meaning of life, in my view, is you achieve some insight into your personal meaning of life by taking time to ask yourself, well, what is it that I want to accomplish in life? Because, and why? So for the REBT psychotherapist and philosopher, we're going to argue that life is an opportunity to do something. Now, what is it that you do with that opportunity? Well, you could use it as an opportunity to have fun, so pleasure, or you could use it as an opportunity to prove that you are worthy of life in the next life, which is a different assumption, and that is that you'll have another life and that you use this one as kind of like a preparation for that one, or a means of getting that one. So I don't mean to offend anybody who believes in an afterlife, but I start with the assumption that my life, our lives as we know it today, are what we're sure about. And therefore, what do we want to do that will increase good use of this life is the question to meaning. What will, and for me, it's a judicious mixture of meaningful activities and pleasurable activities. Now, many of the meaningful activities become pleasurable because, for example, I find that teaching people about rational emotive behavior therapy as a tool for living well is something I do. It gives me meaning, but the more I do it, and the more, and as I say it in clearer ways and more clever ways, I have a sense of mastery, which then increases the fun I have in life. So I think life is an opportunity to have fun. I agree with Albert Ellis that it's an opportunity to enjoy yourself, not prove yourself worthy of being a human. You don't have to prove yourself to anyone unless you think you do, and then you have a serious emotional problem. What you can do is experiment, because the only way you're going to know what you like is to try it. So if you've never gone fishing, try fishing. If you've only fished in ponds or rivers, try deep sea fishing. If you've never cooked for yourself, see what it's like to cook a meal for yourself. Experiment. Experiments are how we learn, and learn what we like and what we don't like. I would say it's important to collect enough data before you decide on what you like or don't like, because a good scientist will always collect enough data. And so when I dated, before I was married, I used to have this rule of thumb that I had to give the person that I was dating enough time for me to get to know them before I made a decision as to whether I wanted to continue to date them or not. Because people don't always put their best foot forward. They might be anxious or nervous or you know, whatever, uncomfortable. And so you want to experiment to figure out what you like to do in life. And it might be something like, do you like helping other people? Well, volunteer at a feeding, working in a homeless shelter. So I think what you want to do to enjoy life is to find the meaning of life is to experiment. But I would suggest you experiment with pleasurable activities, not activities that are strictly aversive. But sometimes you have to do uncomfortable things to get to the pleasure. So if you want to run a marathon, like one time I said, I want to run a marathon. So I had to train for the marathon in order to run 26 miles. So I experimented with marathoning, and then I found out that I really much liked it. So I would say experiment as a means to find. Now, also remember that you're going to live for today and for tomorrow. So if you're going to have a meaningful life, you're going to have to make the assumption you're going to be around for a little bit. So don't do something that will only give you pleasure in the moment or today. So let's say, for example, you like to gamble and you find it very exciting. Well, if you gamble all your money today, you're not going to have anything if you lose, but you may very well lose. So you may have a lot of fun today and a lot of pain tomorrow, and then you're going to be out in the street. So what we always say in REBT is to balance out future pleasures with present pleasures. We call that long-term hedonism. Hedonism is the philosophy of pleasure, and we're going to encourage you to balance out long-term the pleasures of tomorrow against the pleasures of today. And you want to be careful. All work and no play makes Ninkunja a dull woman. And so you want to have a balance between work and pleasure. But ultimately your work will lead to pleasures, and hopefully maybe even your work will be pleasant to do. So if I work 6 days a week because I really like working on Saturday, because I like talking about REBT and teaching it to patients. And so, so experiment with different pleasurable, meaningful activities, and that's how you'll discover the meaning of life, what's good for you to spend your time doing. And remember, what's good today may be 10 years from now, may no longer be good. So you may have to do experiments as an older person, because what you maybe as a younger person, you could run in marathons. Now I'm injured, I can't run in marathons. So now I have to do other experiments as a 60-year-old man to find out what I like at 60 and can do. So experiment throughout life.
That's right. And would it be wise enough to also suggest at this point to people that while you are setting the goals, even having a realistic goal set is something very important, because not every time that they set the goals, they're going to definitely get the joy out of it. There's a possibility they might fail at it. And so at that time also, it's important to remind that how we can have the flexible attitude there as well, in order to be at the negative healthy emotions than the negative unhealthy emotions. Would that be wise enough to suggest?
Yeah, well, yes, because that kind of ties into this idea I said about experimenting and collecting enough data. The first time you try to cook a meal, you may burn the food. And so you want to have an attitude that allows you to fail. If you can't fail rationally, it's going to be very hard to succeed. So when I was a young person, one of my baseball coaches used to say, if you can't lose, you won't learn how to win. And what he meant by that is loss is inevitable, failure is inevitable. And if you or react to loss or failure with emotional disturbance by saying, I must not lose, or I must quickly master cooking, well, then you won't stay with it and then learn that you really love cooking and that you can get very creative with it. And so, to your point, you need to have a flexible attitude. Like, I want to get good at cooking quickly, but I don't have to do so. And I'll stay with it long enough to do a good experiment to see if maybe at some point I'll enjoy cooking. Writing is another thing. If you like to write, the first thing you write, you probably won't get published.
Right.
A lot of people might not notice, but Albert wrote a fine book when he was 19 called How to Make Yourself Happy, or How to Conquer Unhappiness. And it's in the rare book manuscript archives of Columbia University. And as a 19-year-old, he was writing a 100-page book on happiness. And a lot of what he was talking about as a 19-year-old, you could see the seeds of future REBT theory. And in that book, the chapters have to do like conquer. The one point I read it. I went to Columbia University to read this, and the one point he makes is what makes you happy and what makes me happy are going to be different.
Right.
So you better find out what's good for you.
That's
Some
true.
people might want to be a natural scientist, and other people might want to be a social scientist. So let's not try to make everybody a social scientist.
That's right.
And
That's
so
right.
experiment at what you think will make you live this life well, so that you have fewer regrets down the road.
I agree, because I possibly can't copy paste your goals, or somebody else can't copy paste my goals. We'll have to have those meanings found out ourselves by experimenting. So I totally agree to that.
And what will allow you to experiment with what you really like is unconditional self-acceptance.
Right.
I mean, so for example, whether it be in the area of sex, love, career, if you accept yourself, you will be a better experimenter than if you don't. So doing what you want often and experimenting to see if this career is right for you, or that career is right for you, or this person is right for you, or that person is right for you, involves not needing approval from other people. If you say, I have to have my parents' approval, you won't do the experiments that you need to do in order to discover what you really like. Right. And so self-acceptance that is given to you by you enables you to then go and discover the ways that live your life that make you most happy and lead a most meaningful life. So you better cultivate unconditional self-acceptance, which is another whole thing to talk about. I think it's the most important thing a human can do in their life, is to cultivate a deep, deep, deep conviction of unconditional self-acceptance. I think that's the most highest developmental milestone a human can achieve, is to accept themselves through and through.
That's right. And while there are too many things that I definitely feel like discussing with you, but since we have a short time available with us, but I definitely would want to discuss, and because I especially would like the audience to know about it, from our earlier conversation where we talked about how it's important for people to carry this one, I would say, emotion with concern later on also, which is more of healthy emotion for people to carry, so that they do not get into a very lenient attitude also post-pandemic, nor they get into a very anxious attitude. So would you please discuss about that as well? Because that was one interesting thing which I found out from our earlier conversation, which I think everyone would also like.
Yeah, I always say that concern is my favorite negative emotion. So what makes REBT distinct from other cognitive behavioral therapies is that we argue that there are healthy negative emotions.
Yes.
And I always say that concern and disappointment are my favorite healthy negative emotions. And what do I mean by that? concern is an emotion that tells me that it's important for me to recognize that there are possible threats in my environment, and that it would be in my best interest to acknowledge those threats and to strategically plan to meet those threats.
Right.
Anxiety, on the other hand, is an emotion that, like concern, it's kind of like its sibling. It's like concern insofar it has to do with threat detection. But now the threat in both concern and anxiety has to do with either our comfort and safety, which are really the same thing, comfort being the more vague, general category, comfort and safety, or our egos. So for example, we'll get anxious when we have to do a talk because we may do poorly, and that's a threat, your disapproval, the audience's disapproval. So concern and anxiety. So with the pandemic, obviously getting sick is the threat, and possibly even dying, or getting sick and giving it to a family member and you survive, but then finding out that, you know, your mother died and you test positive and you go, well, there's a good chance that maybe she got it from me and I didn't really practice good effort.
Right.
So concern is a motivating emotion that will encourage you to do what's in your long-term best interest, even if it's uncomfortable in the short run. Anxiety will be a threat detection, but it will block you sometimes from doing what's in your best interest, because with anxiety, you will have a narrowing of your visual field, and you may then have biased thoughts like biased automatic thoughts like, there's nothing I can do to keep myself healthy. So why even wear a mask and keep my hands clean? It probably won't work. Or you may have with anxiety, I'm certain I'm going to get it, which is an automatic thought predicting gloom and doom. And so, or with anxiety, you may withdraw and pull back. That's what people do with anxiety. Right. With anxiety, people tend to avoid. Right. They also pull back with depression. So concern is going to, as I say it, concern causes us to lean into the threat and deal with it in a strategic way, where anxiety is an emotion that causes us to withdraw. And the thinking behind them is very different. So with concern, you're saying COVID-19 illness is a bad thing. It may even be a life-threatening thing. Therefore, it would be in my long-term best interest to do everything to do everything possible, right, that's reasonable, all things considered, to keep myself healthy. Where the anxious person will say, I must not get COVID-19. That would be the end of the world. I can't stand it. I'm certain to get it. I will get it. There's nothing I can do to protect myself. Yeah. So concern is a healthy emotion that motivates us. It's a call to action, but it's a call to sensible action. Anxiety very often is a call to action, but it can be a call to self-defeating action and avoidance.
Okay. It's 10 o'clock.
That's great. Was that your Mac replying to?
Yes, my Mac tells me the time.
Yeah, exactly. That just kind of gave me a message also that now I should open this platform for the audience to ask their questions. They can either write in the chat box and I can ask them on their behalf to Dr. Matweychuk, or else you can actually try what Dr. Matweychuk said, which is shame attack exercise, if some of you are already thinking that that might be discomfortable for you. And whatever queries you have, I'm sure he'll be more than happy to address them. Am I right?
Yes, absolutely. In fact, I find that when I take the questions, it's usually very interesting. So fire away.
Perfect. So there is one thing which has come in the chat box, which you can also see, is please briefly touch upon disappointment, because you, I think, mentioned, Dr. Matweychuk, that you have two favorite healthy negative emotion. So that's something people want to know.
So when I don't get what I want,
Yeah.
right, can either be depressed,
right,
because I've failed or I've suffered a loss, or I can be sad and disappointed. So the theory of REBT says that when you have a wish or a want that goes unfulfilled, you're disappointed. I did not get what I want.
right.
But I acknowledge that that's the way life goes. I don't always have to get what I want too damn bad. That's going to lead me to have a sense of disappointment. With that sense of disappointment, I will then be motivated perhaps to try harder next time, or try more creatively to get what I want, to change A, to use the ABC model of REBT. The disappointment at C will motivate me to go back to A and try to more cleverly obtain what I want. So disappointment is going to lead to pro-social constructive behavior, or at least it's going to increase the probability of that. Whereas if I get depressed or angry, even with, it's an opposite of anger. So let's say, for example, you cross me, Nikunja. I could say to myself, Nikunja must not do that. And I could be very angry at you, or I could be very disappointed with what you've done. And I could say, Nikunja, I would like to speak to you about something. I don't like when you do X. I wish you would not do that. And so please don't do that again in our relationship, because if you do, it's going to be something that is going to cause me to think about maybe maintaining a relationship with you. So disappointment is going to allow me to be assertive. Whereas if I get rageful and angry with you, I might bite your head off and say something I later regret, say something very hurtful that you never forget. I may, if I get depressed, so when I don't get what I want, and if I get depressed, I'm not going to try so hard to get it. Whereas if I get disappointed, I'm going to go, shucks, what could I do now next time to get this? So in that regard, disappointment, I think, allows me to bounce back, to be resilient.
And it's a perfect balance between being aggressive versus being passive, and coming to the middle one, which is the healthier one, that is being assertive. So that's striving a balance between the two extremes. Okay. There's a next question also.
But I should say, one of the things I plan to do on my website, rebtdoctor.com, is make a series of audios, and there are audios and videos there now that you could listen to, plenty of them, but I'm going to make additional ones, and I'm going to start talking about the healthy and unhealthy.
Dr. Matweychuk, I think your audio is not audible. We cannot hear you.
Oh.
Now we can. Okay, no, again we can't. So you'll have to unmute yourself. I think I'm seeing that you have to mute.
Okay.
Now this is perfect. Yeah.
I'm not going to touch my cursor. For some reason, it keeps on defaulting.
No problem.
So anyway, on my website, rebtdoctor.com, I have audio, that are freely available. And what I plan to do is start making a series of videos and audios where I talk about two emotions: anger, unhealthy anger, and healthy anger. Anxiety and concern, unhealthy jealousy and healthy jealousy. There's a good example. People don't understand. What would healthy jealousy look like?
That's true.
So that's what I'm going to be adding to my website. Lots of free audio. So don't be afraid to go there and listen to it and share it with your friends.
Perhaps I'll put this again to everyone, so everyone can go and check, because that question still might be there in many of their mind, that how is it even healthy jealousy or healthy envy? And this comes in our trainings as well, that people are like, is there any healthy jealousy also, or is there any healthy envy also? So I think it would be a great resource to go back to that website, what you just referred, and people can read more about that.
Yes, so I'm going to be doing that. Yes, good.
Perfect, perfect. The next question that has come in is, do your IBs, and by that I mean irrational beliefs, keep changing over a period of time, and are they age related?
Well, yeah. I mean, see, here's the thing. The person who asked that question probably needs to understand that the content of an irrational attitude may change over time. So, for example, people will say something like when they're a young athlete, a young man might say, "I have to be the best athlete." When they're a youngster, if not, I'm not so good. Then when he stops playing sports, he may go to graduate school and say, "I have to be the best student." And then when he has children, he might say, "I have to have the best children." So the content of your irrational attitude may change over time based upon the context of your life and your goals. But the irrational process stays the same, which is a demand that you do perfectly well, other people treat you well, and that life be the way you want it to be, nice and easy. So that tends to stay constant. But the specific irrational attitudes can morph, if you will, to match the adversities in your life. Now, if the adversity stays constant throughout your life, let's say, for example, you have a big family and you have 10 children, right? You might say, "I want every one of my children, and they must all be scholars." So you're going to have that irrational attitude over the lifetime of all 10 of your children. If you may very, so the question the person asked is, how does the irrational attitude and the adversity interact? I think that some adversities tend to be lifelong, where others tend to be shorter lived. I mean, pandemics hopefully happen once in a lifetime. So let's hope that we've gotten that adversity out of the way for our lives.
True. Yes, I hope that answers very clearly the question that Ms. Singh asked us. Okay, so that brings me to another question, and I think from the chat box, I'm taking this as a last question, and then I will keep the videos on, or I'll ask everyone to keep their video on so they can ask the question on the videos. Is how do we use rational imagery in a day-to-day stress? So you have discussed this previously, but would you like to brief it again on how to use this imagery, REI, in the day-to-day stress also?
So let's do it right now. We all could do a 2-minute rational emotive imagery exercise. So for example, I would suggest you close your eyes and imagine a particular event or stressor, psychosocial stressor, a particular adversity that you could very well find anxiety provoking or associated with an anger reaction, something that you would, generally speaking, find stressful. So picture that picture that adversity, picture that stressor. Get that in your mind. Select one. Okay, so I have one in my head. You hopefully will have one in yours.
Yeah.
Now, get in touch with the feeling that you typically would feel. So, for example, it might be panic, it might be anxiety, it might be worry, it could be anger, it could be unhealthy jealousy, it could be any one of those, shame. Okay? Get in touch with that feeling. That should be pretty easy to do because that's what you typically will feel when you have this particular stressor.
Yeah.
Okay. Now that you felt that emotion that you typically feel, I want you to convert it, transform it. Just like an ice cube will melt into water, it's still water, but it's transformed into a different state with different characteristics. I want you to transform the anxiety that you would typically feel, or the anger, or the shame. I want you to transform that into a healthy negative emotion. Now, those healthy negative emotions might be concern, might be annoyance or displeasure or disappointment, or even a sadness. But that's very different than the unhealthy negative emotion. So transform your emotion. Just work with the emotion and keep the stressor constant. Don't change that. So if you were picturing yourself getting ridiculed or criticized, keep that constant. If you were picturing yourself being given bad news by a doctor saying that you tested positive for COVID-19, keep that constant, but change your anxiety to concern. Change your anger to disappointment or annoyance. Change your depression to sadness or disappointment. You can do it. Just assume that you can change your emotion and experience in relation to that adversity, that stressor, allow yourself to experience a different emotion that's healthy. Yeah. All right, now you can open your eyes. So that's more or less the exercise. And there's only one way to do it. And that is to go and think differently about the stressor. So for example, if you were picturing yourself being told that you're positive for COVID-19 by a doctor and you were really anxious, you might have made yourself anxious. Now to get yourself to concern, you could have said, well, this is certainly not good, but it's not necessarily the end of the world.
Absolutely.
Okay, stay calm. I'm concerned about the news I'm being given, but let's not put the cart before the horse and call the undertaker just yet.
Right.
This is not necessarily the end of the world. I need to do a number of things to kind of recover from this illness and not give it to other people. All the conditions were right for me to have it, and so now I have it. Now let's see how I can move to the conditions that will allow me not to have it. So the only way you change anxiety to concern is by changing how you think. And so this is an opportunity to transform the emotion by thinking.
Certainly, and that helps you to even realize and make yourself understand that you have the power to change your own emotional state. It's like empowering yourself.
Yeah, the Stoics used to call it preparing for adversity. So absolutely. Albert called it rational emotive imagery, call it whatever you want to call it. You're in imagery rehearsing a rational attitude in order to have a rational emotion or a healthy emotion.
That's true. That's true. Great. So we are going to take a few questions now on the video because I see some people raising their hands. So yeah, you can, whoever wants to ask it on the video, you can unmute yourself and go ahead. We might take 1 or 2 questions. Yeah.
Unmute yourself. If you're going to do it, unmute yourself.
Yeah. I see a couple of them raising their hands, so you got to get your chance, take your chance and just ask a question.
Somebody put themselves first, or else no one's going to ask a question. In REBT, we encourage you to put yourself first, and others a close second. So succinctly ask a question, someone.
So how about I just take a couple of names that I see have raised their hands, and if they want to ask, they might as well try this. Yeah. Okay, so I see currently Miss Gurpreet raising her hand. So Gurpreet, would you like to go first to ask a question? I probably would want to wait for a few seconds and then move ahead to somebody else. Okay. Then I see Miss Satya raising her hand. Well, Dr. Matweychuk, I don't know if that's a technical problem or by mistake they had raised hands. Or now I have Abhinaya who also has raised her hand. So,
Yes.
Abhinaya, would you like to? Yes, we can hear you.
Yes.
Go
Hi.
ahead.
So yeah, I wanted to ask. So initially with REBT, like you often write down A, B, C, D, right? And
Yeah.
so at one point, I believe like it's all supposed to happen in your head, right? Where you don't need to necessarily write it down.
Well, it would be better if it happened that way, but you know, here's the deal. When you challenge through disputing your irrational attitudes,
Mm-hmm.
you will probably have to do it after having experienced unhealthy negative emotion, because you notice that you have one and then you dispute it.
Right.
With that said, right, if you work on let's say I always get upset because I often get upset because I say to myself, people have to do things my way. So my wife does something and I go, all right, let me sit down and dispute that. Well, does my wife have to do things my way? Answer, no. Would it be better if she did? Probably yes. Okay. Then I go to work and my colleague does something that I don't like. And I say, I get myself angry. He should do things my way. After all, I'm really smart. And then I say, well, even if I am smart, I'll dispute that attitude. It doesn't mean he has to agree with me. It doesn't mean he has to do things my way. So now, over a period of time, I've disputed very similar irrational attitudes. If you do that often enough, you begin to get the idea in your head that people don't have to do things your way. Okay. Then you have to take into account that we have a hierarchy of values. So let's assume you have low order of value and high order value. So let's say, for example, if people don't agree with you, that's a low order value. And if people do things stupidly, that's a low order value. And then if people insult you, that's a higher order value, right? So if you have successfully, over a period of time, challenged the idea that people can do things stupidly, that they don't have to do things in the smart way, right? When they do something stupid, you may automatically jump to, oh, well, that's what they do. No sense getting upset about it. But they must not insult me may very well be an attitude that you need to continue to dispute for a longer period of time, because you either haven't had as much practice at disputing it, or it's more well practiced. So my answer to you is that if you dispute on a regular basis attitudes, you may very well make some progress where you automatically go to that attitude when something happens.
Right.
But on the other hand, even somebody like me who's practiced REBT for 30 years, I'm not going to sit here and tell you I'd never get angry.
Yeah.
In fact, if there's an emotion I'm going to be at risk to feel, it's probably going to be anger or anxiety. But I'll tell you something, what will happen is it happens with less frequency now than it did years ago. It happens with less intensity because I've disputed more. And it happens only with higher order threats or higher order values, transgressions. And when it does happen, I shorten the duration of the time. So like with anger, right? Let's say somebody does something and I get angry and I could feel it, right? I try to quickly acknowledge to myself that I'm angry and quickly transform that hot emotion into disappointment. So, because I say to myself, your anger is self-defeating, it will defeat you, and you can accept yourself with your anger. Just because you're an REBT therapist doesn't mean you must not be angry.
Right.
And
Dr. Matweychuk, you have gone on a mute again.
oh, sorry,
No
I
problem.
screwed up.
That's
Just
okay.
so I say to myself, just because you're an REBT therapist and you try to practice what you preach does not mean you must not get angry. But the minute I get angry, I quickly acknowledge it to myself and say, you better stop that, because it's not going to help you solve this problem with this person or in your, or let's say I get angry with my computer. Then, you just keep on trying the same stupid remedy. It doesn't work after the 15th time. Why would you think it works on the 16th time?
Yeah.
That's what anger does. So you can get to the point where you function with more rationality on a regular basis, but because you're human, you cannot extinguish, you cannot perfect yourself, and you will still always have an Achilles heel. So you will always have to guard against unhealthy negative emotions, even if you've been at the game 50 years.
Right. Yeah. And that's interesting that you don't have to necessarily say to yourself that you do not have to get angry. I mean, you can get angry. The art is about just not remaining into that anger for a long time. And that's how we can also measure our progress on adopting that rational attitude, isn't it?
Yes, frequency, intensity, and duration are three good
Absolutely.
variables to look at. I mean, I have to tell you, I used to get scared going to school as a child. I didn't want to go to school. Kindergarten and first grade, I was crying.
Right.
Well, now I don't get scared, and I'll pretty much tell most people whatever I think most of the time, unless it's very self-defeating to do so. So I've gotten much better, but I still have occasional periods of anxiety, at which point I acknowledge and then I try to convert into or transform into healthy concern so I can strategically deal with the threat.
True. That's perfect. Okay, great. Thank you for that question and that precise answer as well. Doctor, I have received one question privately. If you would like to take that up, is how can one stop repeating the same mistakes repeatedly?
Well, you need to understand, you need to understand the emotions that are contributing to the mistake.
Yeah.
To answer this question succinctly, I'm going to suggest to you that you raise your discomfort tolerance, because if you're making the same mistake over and over again,
True.
unless you are incredibly unobservant, you probably have an idea of how it would be better to respond. But I would suspect that you have low discomfort tolerance in saying it's too damn hard to respond differently. So to answer your question succinctly, without super customizing it to you, I would say that it's an issue of low discomfort. If you're making the same mistake over and over again, then it's probably a problem of low discomfort tolerance, where you're saying, I know how to act better, but it's too damn hard, so I'll just do the same thing over and over again.
Yeah.
That's one idea. If you're making the same mistake with people, then I would suspect either, like, let's say, for example, you're always allowing people to take advantage of you. Then you may have the same attitude of need for approval. I must have the approval of other people, and then you're going to make the same mistake over and over again, allowing people to take advantage of you, and you're never going to be assertive.
Right.
If you're getting angry with people over and over again, there's a good chance you're having the attitude that, people have to do it my way. People have to do it my way, and you just are not you're not getting rid of that attitude. So, but in the end, I would say on a general basis that even if you're having low discomfort, a need for approval or a demand that people do it your way, what's keeping you locked into that thinking is you're saying it's too damn hard to think otherwise. I have to have people's approval. It's too hard to risk their disapproval, or it's too hard not to accept people as they are, and that they're going to do things their way, not my way. So I'm going to demand that they do things my way. So I would say it's probably a problem of low discomfort tolerance. And I always say to people, it makes for a more interesting life if you're always making new mistakes. So make new mistakes and not the same one over and over again.
Right, right. And while someone is asking, this entire model of REBT just doesn't specifically work for any one problem or one condition. It works for everything. It works for any adversity or to deal with any emotion, be it anger, anxiety. That was one of the questions, Doctor, that had come into my chat privately. So I just thought of addressing that.
So I would say that it can be applied to any problem. I wouldn't go as far as to say it works, because the variable that makes it work is you. And if you, REBT works if you work it. But if you don't work it, it won't work. So I would say that it can be applied. And that's why I love REBT, because it can apply to the most difficult existential problems of life. Like,
That's right.
I'm going to die. I have a patient now who's just a little older than I am, who learned that he had a brain tumor, and he has had it removed, but that there's probably he will die, and then it's come back. So he'll probably die over the next year, and we're helping him accept that and to manage. By the way, Albert has a book called How to Cope with Fatal Illness. So REBT can apply to things like death, but it can also be applied to a spider phobia, procrastination. It can be applied to guilt. Let's say you've done some bad things and you feel guilty about them. Shame. So it's very broadly applicable. And that's what I like. It doesn't handcuff me as a psychologist. Now, some psychotherapies will challenge your perspective that something bad may not happen. Cognitive therapy is very fond of challenging automatic thoughts and inferences. Well, that's okay. However, it's a little less applicable to challenge an inference when you find that the inference or the automatic thought is true. So if you say to somebody, well, look, the doctor said you have a spot on your brain, it may not be cancer. Well, that's okay to say, because we don't know for sure. But let's say, for example, you say, I may fail. I may fail at this test. And we could say, you may not. What are the chances if you study? But what REBT does is really attack a deeper level condition, which is that you must not fail, and it'd be awful terrible to fail. And so we kind of get it both ways. We sometimes go with the inferential disputing. There are some instances where it's appropriate, but REBT is a broad-based, it's broadly applicable. It can help people who have been raped. It can help people who have done heinous crimes. If they wish to change, they have to want to change. If they don't want to change, they know nothing's going to help them. You have to want to. I always say to my patients, I'm the constant, you're the variable. You have to work it, not me. You can bet that I'll do my part. The question is whether you'll do what I ask you to do.
That's right.
Interestingly enough, even medical procedures, right? A friend of mine told me that I was amazed. I think he said 60 or 70% of prescriptions that physicians write aren't filled. Now, I didn't think it'd be that many. I could see maybe 20%, right? One time a doctor gave me a prescription for painkillers after skin surgery, and I never filled them because I thought he was crazy to give me an opioid for a simple pain problem. I didn't want to take it. But what I'm saying is most medical procedures, if you have high enough discomfort tolerance and you do what the doctor tells you to do, you usually get some degree of relief. So REBT will work if you work it, but so will physical therapy for a bad back. If you do the exercises to strengthen your stomach, your back will feel better. Or if you do what the physical therapist says, which is to stand up every so often and don't just sit for hours and hours on end, then you'll get better. So many, many treatments work. The problem is the low discomfort tolerance. People say, I want to get better, but I want to get better the way I think I should get better, not the way that works empirically.
That works. Yeah. Okay. So that brings us to, because we are running over time, that brings us to the end of the webinar, but not the end of the learning per se. So some of the questions that I have received, which we couldn't answer right now, I'll try to address them after discussing with Dr. Matweychuk later. So you can stay in touch with us on the social media platforms, the links of which you will receive in the chat box. And also I'll be sending across the resource which Dr. Matweychuk mentioned, on which you can read, hear, listen to many recordings, and also I think read a lot of articles, which will be very helpful for you to keep your continuous learning and the practice alive.
Yes, and if you send me those questions, right?
I will. I would be
I'll
in
tell you
fact
what,
happy.
on my website, I do have a tab that attempts to ask a question. So I could write about some of those
Great.
questions. So
Great. So I'm going to save this file.
I'll chip away at some of them.
Right. I'm going to save this
Go to
question
my
file.
website and listen to the audio. It's rebtdoctor.com. And also, I have an intermittent reinforcement email that I send out. And in this email, I aim to talk about some of the core concepts and the general applications of REBT. So you can enhance your learning through intermittent reinforcement with my email. So there's different ways that you could keep in touch.
Right, definitely. So I'm going to save this question files and I'm going to send it across to you on an email. And at your free time, at your convenience, you can just address them and people will be more than happy to hear your opinions on the same. Yes?
Yeah, if you go on my website, it'll say, I think the tab I have, I should look at it, but the tab says something like ask Dr. Matweychuk or something like that.
Sure.
And so you'll find it. Poke around.
Okay.
Sure.
Okay. Yes. So thank you so much, Dr. Matweychuk. It was lovely interacting with you. It's always great talking to you. And I'm sure audience wonderfully have also gotten their doubts addressed and they have experienced this entire discussion. And that has helped precisely to, really adapt to this lifestyle change in a more healthier manner. So once again, thank you so much for coming on board for this webinar. And on behalf of everyone also, I would like to thank you. And I'm going to actually unmute everyone so everyone can just bid a goodbye to you. And yeah. Yes, everyone is on mute.
Thank you and bye.
Thank you.
Thank you so much.
My pleasure. I always tell my students that the teacher needs the students as much as the students need the teacher. It's a yin-yang kind of thing. So thank you for spending your Saturday night with me. And I enjoy talking and disseminating REBT. It's fun. It's actually a very meaningful activity for me. So thank you. And what I would say is keep at it. Your REBT works, but you have to stay with it. It's hard to implement sometimes, but if you stay with it, you will be rewarded. It's like most things in life. If you put enough effort into it, you'll get something out of it. So take care.
Yes.
Thank you so much. Have a great day.
You will receive the link of this recording also on the YouTube channel. We will share that link. So some of you have said that they missed some parts. So you can definitely hear that out in the link that we'll be uploading on the YouTube channel. That's of EMOTICONS India. And we'll be sharing that link with all. So once again, thank you. Have a great weekend ahead. And have a great day to you, Dr. Matweychuk. I'll stay in touch with you. Yes. Bye-bye.